you ever wondered how your expectations can shape your experience of pain? In the world of neuroscience, two fascinating phenomena, placebo and nocebo effects, demonstrate just how powerful our minds can be. Placebo effects occur when positive expectations lead to symptom relief, even from an inactive treatment. In contrast, nocebo effects arise when negative expectations actually worsen symptoms. While both are well known in medicine and psychology, scientists have long debated which effect is stronger and more persistent. Recent research set out to directly compare these effects in healthy individuals, aiming to uncover whether negative expectations truly have a greater impact than positive ones. Let's dive into the study's design and what makes these effects so intriguing. Explore the strength and duration of placebo and nocebo effects. Researchers recruited over 100 healthy volunteers. Participants experienced controlled heat pain while their expectations were carefully manipulated. Using a combination of verbal instructions and a sham electrical stimulation, the team created three conditions: one where participants expected pain relief, placebo; one where they expected increased pain, nocebo; and a neutral control. Pain ratings were collected immediately after the expectation was set and again 1 week later. The results were striking. Both placebo and nocebo effects were observed right away and persisted for at least a week. However, the nocebo effect, where negative expectations increased pain, was consistently stronger than the placebo effect. This pattern held true even after accounting for differences in how the conditioning was delivered. Why do negative expectations have such a powerful and lasting impact? The answer may lie in our evolutionary history. Humans are wired to pay more attention to potential threats, better safe than sorry strategy that once helped our ancestors survive. Brain imaging studies show that negative information is processed more readily than positive, and fear or anxiety can amplify how we perceive pain. This study, the nocebo effect, not only appeared more quickly, but also faded more slowly than the placebo effect. Interestingly, the strength of these effects was influenced by recent experiences and certain psychological traits, like how intensely someone feels bodily sensations or how competent they perceive the experimenter to be. These findings highlight the importance of managing expectations in clinical care, as negative suggestions can unintentionally worsen symptoms. These discoveries have real-world implications. In clinical practice, understanding that nocebo effects are not just the reverse of placebo effects, but may be driven by different mechanisms, can help healthcare providers improve patient outcomes. Simple strategies like positive framing, building trust, and avoiding unnecessary focus on side effects can reduce the risk of triggering nocebo responses. Study also suggests that monitoring patients over longer periods is crucial, as negative expectations can have lasting effects on treatment success. Ultimately, this research reminds us that our minds play a central role in how we experience pain and healing, and that managing expectations is a key part of effective care.